Practicing modern medicine is hard. It's often so much harder than it should be. And I know this not just as a physician and a wellness leader, but from deep personal experience. Several years ago, I stepped into my first role as a medical director. I was raising 2 young kids under 3 and caring for my mom who had just been diagnosed with terminal breast cancer. Around that same time, one of our full-time night docs got sick and ended up in the ICU. So I had to take him off the schedule. And I thought that I could deal with all of this by myself. And honestly, I didn't want to have to need help. But instead, burnout hit me. First, it was subtle. I had trouble sleeping. I started to experience neck and jaw pain. But then it was like a brick wall. And I knew that if I was going to sustain the career that I loved so much and had trained so hard for, something was going to have to change. Thankfully, I wasn't alone. I had a community, I had family, and I had colleagues that reached out with compassion. Coaching and resiliency training helped me reset, and I learned how to heal and regulate my nervous system. I set boundaries, and I was able to lead from a place of strength, not survival. This work is deeply personal, not just because of my own story, but because of stories like Dr. Lorna Brain, a brilliant emergency physician, a respectful leader, and tragically, a victim of a system that didn't protect her mental health. The good news is that being fulfilled and finding joy in your work as a clinician is entirely possible. We know it's possible because we're doing it. At Vituity, we're dedicated to building systems where clinicians can thrive. We have proof that with the right culture and commitment, physician burnout doesn't have to be a fact of life. In fact, in 2024, only 18% of Vituity doctors reported symptoms of burnout. That's 62% lower than the national average. And these aren't just surface level changes that we're making, they are embedded into how we lead, how we live, and how we care. Our programs address wellness from multiple dimensions, including operational efficiency, helping remove any of the barriers between that sacred relationship of a physician and a patient, as well as culture, where we prioritize physician autonomy and flexibility, allowing our clinicians to have more control over their lives and better work-life balance. And personal resilience, like our Resiliency course that teaches science-backed skills to manage daily stressors, and our annual wellness retreat that's available to all of our physicians as well as their significant others, because we know that burnout doesn't happen to just a clinician in a silo. It affects all of those people around you that love you and want to support you. And leadership coaching. When I think back to my hardest moments, I wish I had known that burnout was not inevitable, and that in fact, it's actually preventable. And now, I am on a mission for every clinician to know this too. So, to healthcare leaders who are listening, I want you to know that investing in wellness is not optional. It is essential. And to my fellow clinicians, you chose a career as a healer, as someone who wants to serve their community in a truly impactful way. And what you do matters. You absolutely deserve to love what you do. Please don't settle for anything less.